I am Mike Tallhammer. I am the chief of physics for Centura Health. I've been asked to kind of give our experience in evaluating our clinical experience with the next generation platform for Align RT. Uh, these are my disclosures. I was also asked to give a big picture of what is SGRT in case anyone in the room was unfamiliar with that. I feel we're probably pretty familiar after 2 talks, so we can more or less the surface guided radiation therapy is using a stereoscopic imaging system, a video-based system to reconstruct a 3D surface of the patient in real time. We track that patient against a reference surface, whether that be a CT surface or an acquired reference surface. It is more than just a setup technology. Some people think it's used for setting up patients, or it is a breast tool, or it is an SRS tool, or it is a something X-like tool. SGRT has a significant ability to change the way you practice radiation oncology if you take advantage of a lot of the different features. It can be used as a setup tool to decrease the time and increase the accuracy of setup without semi-permanent or permanent marks like tattoos. It can be used to augment your IGRT process. A lot of people have 60 couches these days, but I've yet to see Varian come out with a posturepedic couch. So if you have postural problems, the IGRT couch is of no use to you. It helps you develop confidence through patient identification systems, which we'll talk about, reduction in the need for immobilization and excessive imaging for setting up patients and maintaining that or seeing that they maintain that position throughout treatment. It's obviously we've heard as using it as a motion management, whether at the Linac for gating or at CT for 4D CT acquisition. And we saw some nice collision detection stuff as well in the first talk. And then kind of an underappreciated aspect of the system is a PQI tool. If you are an ABR certified physicist or physician or physicist, if you participate with the Joint Commission, ACR, APEX accreditation, you are all painfully aware of PQI projects and have probably participated in many of them. But these systems give you real-time data on what is happening in your clinic every day on every patient, if that's how you're using them. And that data is actually very valuable to make data-driven decisions. So for our center, this is the gamut of things that we treat. We have 4 facilities around the Denver metro area. Some are hospital-based, some are clinics. They have 4 Varian true beams, all outfitted with SGRT systems. We're looking at putting in a 5th right now at another facility and looking at 5 more. This is becoming the standard of care at our centers. We treat everything from the more simple cases like standard breast, deep inspiration breath hold, chest walls, whether it's right or left chest wall, whole brains, all the way up to trigeminal neuralgia, intracranial SRS mets, SBRT, lung, liver, pancreas, spine, deep inspiration breath hold now for liver and lung SBRT, as well as head and neck. Some indications span more than one of these categories, like head and neck, depending on what you're doing with them. But we basically treat, I always say 98 to 100% of our patients using SGRT. I leave myself 2%, just in case my therapist is in the room and tell me I'm a liar. So I say 100%. Sometimes we may have 1 or 2 clinical emergent cases that don't actually end up with SGRT. What that means for us, we do everything tattooless in our centers. So all 4 of those centers that are currently outfitted with SGRT are completely 100% tattooless across all body sites. We have quick, accurate, and reliable patient identification through facial recognition. We have more accurate setups, shorter, more efficient treatment times, lower dose to critical structures because of the extensive use of DIBH now in our clinics, constant monitoring before, during, and after imaging. So we are not replacing our IGRT process. We're augmenting it with our SGRT process. And then we use this tool extensively for continuous process quality improvement. As we move body site treatments between centers, we can use the SGRT output to kind of drive quality, so we can compare kind of the mothership site to whatever site is now taking on this thing and see if quality is the same, because now we have a set of eyes in the sky that can make sure that we're always watching what we're doing. And so we use this system very extensively. And so when we were asked to kind of go from the past system to the future system, we're obviously very cautious at what we want to do. I had kind of like to be kind of out there doing whatever's new. I have a personality that kind of goes that direction, but you can't sacrifice a pretty well-oiled machine of a program to get something new and kind of throw it at everybody kind of all at once. So we were asked to evaluate the new SGRT platform from Vision RT. We were presented with an early limited release of Align RT, which is version 6.1, which was a limited feature clinical release for us to evaluate. The first general feature release will be 6.2, which is what they're showing at the Astro booth this year. So if I miss any of the features, for those of you who are Vision RT employees, I apologize. Everyone else go to the booth, make sure I'm not lying to you. Evaluation was intended to last 2 to 4 weeks. That gives us enough time to kind of put a number of patients to it, given the volume of patients that we're putting through the system into different body sites. We can look at all of our different workflows. We can also evaluate any interconnectivity that they want us to with the different systems. And so that's what we did. Our initial observations after a weekend install of the system and some really quick physics commissioning is that the software has been completely rewritten and focused on future development. It's written in a more relevant, up-to-date computer language that gives it a more performant feature as far as performance and integration with the hardware on the system. The focus is on a more modern UI design and clinical workflow. The UI design, if you're familiar with the materials design from your Google phone, or if you happen to be a poor soul who has an Apple phone, you can think about Apple phones too. Windows 10, web design, all of those UI designs are more along the lines of what you'll see in the new release if you haven't been by the booth yet. The clinical workflow, what was impressive to me as a clinician who is often at the machine playing with these things, is that the system is built around your clinical workflow. The system doesn't become your clinical workflow. You're not locked into a system. It used to be you would get a new technology and whatever they gave you as a interface was what your workflow ended up being. What I like about the product is they've taken 10 years. I've been a pretty early adopter of SGRT since about 2008 or 9. They've taken all the things we've learned clinically over the years and now redesigned a system that actually addresses your workflow rather than just saying this is what your workflow will be. So we were very impressed with that. As much, like I said, improved in performance and usability because of those workflow focuses. The workflows are obviously a product of clinical user feedback, so it has an extensive incorporation of clinical user feedback into it. Just based on polling my therapists who have used it, we actually rotated all of our therapists through it just to get kind of their input of did we miss something, did we not give enough feedback, because I'm sure that's going to come back to be my fault. Efficiency and safety are now obviously the point of concern, or is the name of the game in this case. This version of the software, we feel that after 10 years, I think Vision RT's kind of figured out the hardware and the technical aspect of what SGRT really is. And now the focus is a more efficient, more safe, integrated user experience for both the clinician using it and as well as the patient. And so those were our initial takeaways of the software. The initial part of the process, we integrated it with the SafeRT IDs system. I don't even know if we're still the only one that has it in the States yet, but no, only in the States. So we still are the only ones that have this clinically running right now. It's a facial recognition product that allows you to do patient identification and accessory identification. The setup devices are easily identified and registered to the patient at the time of SIM, as well as at the time of treatment. It improves our patient experience. We obviously pull our patients. We have a very high-tech industry in Denver, a lot of defense contractors and things like that. So we were a little concerned about facial recognition because, Big Brother's always watching you. And so we were a little worried about rolling this out in the clinic. One of our patients put it, I think, the best. He was like, we had very positive experiences, so we were like, well, let's start asking them what they like about it. And one of our patients lovingly put it is, I'm not barked at when I come into my center anymore. He's like, I don't get the first thing is, hi, what's your name, date of birth, and what are we treating? He's like, I don't need to be reminded of how old I am and that I have cancer every day. He's like, I more like the fact that they ask me, how was your weekend? Did you see your grandkids? Did you get that bike ride in? Did you go hiking or camping or whatever you were supposed to do? And then as we walk into the room where we've placed the cameras, they say, can you please just look at the little orange light? He's like, I know when that light turns green, that whatever you did in that room that I can't see you matches me because it recognizes my face. He's like, just like you recognize my face when you walk in the room and you smile at me, that's an indication to me that everything on the machine is what's supposed to be for me. So he had a very interesting perspective, and that because they kind of talk to one another in the waiting room, that kind of pervaded most of our patient experience. And so it is completely context. It's all facial recognition, so it complies with all of our hospital-based policies and procedures. There's nothing to wipe down. If your guys' hospital infection control is like mine, it's like one step below the Gulag Archipelago. I say, if you touch the patient or anything touches the patient, you're banished to Siberia. So we don't have to worry about that in our centers. And it's also integrated through patient identification through the Align RT product with an interface called EDI. If you have a Varian machine, you have MMI. If you have an Electa machine, you have something called Response. That's how it communicates with Align RT. And now they have an EDI interface that where the Safe RT ID interfaces with Align RT. So you get primary, secondary, and tertiary identification once on your machine, once on Align RT, and then when you do the facial recognition, it says all the accessories, the patient, The name, date of birth, medical record number, plan isocenter, and dosimetric parameters are all significant and attached to this patient through their facial recognition. We used to use barcodes. People routinely lost barcodes on cards, so we'd keep extra cards. I've never had someone in the 11 months I've been doing this forget their face, so it's worked really well. Workflow enhancements, the integration of SafeRT ID we just talked about. Automated DICOM import configuration for patients is like the number one amen moment for all of my therapists. It is completely done through a modernized DICOM receiver, so everything comes in pre-registered for that patient. You get a little half moon, very similar to what you would get in your Android apps or your Apple apps, saying that you need to draw an ROI and some configuration. So it's very modern design, very user-friendly for people who are used to using a smartphone. The ability to hide and unhide treatments and ROIs is key for us. We have a lot of frequent flyers, a lot of multiple myeloma and multiple METS patients where they have multiple metastatic sites that we're kind of just spot dealing with from time to time. Easy navigation between the preparation and treatment workspaces, and the addition of tool palettes in the treatment workspace allows us to troubleshoot patient setups way more efficiently and more effectively. So they've moved all the troubleshooting tools into the treatment workspace that we can do that. New session capture, this is where the therapist really saw the user feedback being integrated into the system. Session captures are a temporary capture for just today's session. It incredibly changes the ball game for bolus workflows and imaging workflows if you're tracking your patients during cone beam CT. And then down here at the bottom, because this is what I really wanted, so that's how important it was to me, it made it to the bottom, is the postural setup. We use a lot of postural setups for our patients. We augment our IGRT process extensively. If you've seen him in my head and neck talks, postural setup is a lifesaver. Clinical efficiency, the things that we found with the new system, there's a focus on minimizing clicks or your mouse mileage, as they call it. There's 60% reduction in the time to import a patient for the therapist. So now if you have a very busy clinic and you're doing a lot of importing at the machine and you don't have a secondary workstation, you're reducing that import time by about 60%. I think that's pretty generous or pretty conservative there. I think it's more like 75% based on our experience, especially in a really busy workflow. There's 85% reduction in software clips for the physicist, so now calibrating the system is really, really quick. So if there's anything that you find where you're having an issue where you have to recalibrate the system, we don't have to recalibrate the system very often. We have a couple systems that haven't been calibrated for about 3 years or so. They're very stable, but that calibration process is much more streamlined and easy for the physicist. And then now they've moved a lot of the impactful features that we feel were oftentimes hidden in drop-down buttons and other menus and things like that, more to the forefront. The postural setup and the surface statistics specifically, if you go to the booth, they're all video live feed things now, so you can actually be interacting with the patient, getting a live feed and changing the posture rather than having to click through a menu, taking a static capture, those types of things, which really impacts and enhances our ability to make real-time decisions on our patients. So with all of that, the clinical results for us, our 2 to 4 week clinical trial has now lasted 11 months. That is at the behest, I'll say, I guess that's a nice word, behest of my therapist. It was more or less, we will get the pitchforks and torches and storm the physics castle if you take this away from us. And so we kept it. We've kept it now for 11 months. The patients have grown accustomed to SafeRT ID and the new workflow with the software. We have much more rapid setup times now, but the SafeRT ID seems to be the most impactful thing for the patients. When we're upgrading, we've had some handhelds that have to come from overseas and those types of things as we've kind of grown through the beta testing environment. So there's a couple days here and there where we didn't have SafeRT ID, and there was a noticeable rumbling in the ranks of our patients of why is that gone? Why aren't you using it? Well, we're waiting for new handhelds. This is a beta test environment. And they know we do a lot of educational stuff because we do a lot of site visits. And so they were understanding with it, but it was almost immediate. How long is it going to take? How many fractions do I have to have without it? I mean, it was something that was very noticeable to the patients and something that they really enjoyed because they had to go back to that name, date of birth, what are we treating, because we didn't have the facial recognition stuff. We're looking to expand that facial recognition registration to our registration process and to other applications within our department because it has been so well received, and that integration between SafeRT ID and our EMR, like ARIO, being able to pull the schedules and pull those patients, just all those workflows, things that have been added makes it really nice and easy.